I had a mitral valve repair procedure with Dr. Yadav. It was necessary due to mitral valve prolapse that I've had since I was very young. I was referred by my cardiologist, Dr. Srila Banerjee, to Dr. Yadav, and from the beginning, I had complete trust in Dr. Yadav. She's a cardiac surgeon in one of the biggest specialized hospitals for heart and lung in the UK. She's done a lot of similar procedures. So I've always trusted what she said and what she recommended. Initially, I had a face-to-face appointment with Dr. Yadav. She reviewed all my history, and then she ordered some tests to make sure that I definitely need the procedure and that to see what I actually, to have a clearer picture and to make a plan for the surgery. Then had the tests, and as a follow-up, I had a video call with Dr. Yadav. She then confirmed that the surgery was necessary, and then she said the valve repair is possible, which was very important for me, and that she's very confident in the successful procedure. She recommended, however, open heart surgery to get the best possible outcome. So the procedure was scheduled in a few months, and I got admitted in Royal Brompton Hospital the day before the surgery to settle in and to make sure that I have all the pre-operation tests that were required. I then, in the morning of the surgery, I was a bit nervous. The staff had explained to me what to expect. So I know that it's something that it's a big challenge for my body and for my family. And Dr. Yadav came to see me in the morning of the surgery and reassured me that it's the right time and that she'll do her best for the procedure to be successful. I then got taken into the operation room. Woke up a few hours later, I'm not sure how many. I got taken to the ICU in the hospital, and at one point, I think it was the first evening, Dr. Yadav came and said that the procedure was successful. That was harder than expected, but they managed to repair the valve. It was very important to me to have a valve repair because it allows me to have a normal lifestyle, a normal quality of life, and something that means a lot to me and my family. And Dr. Yadav said that she did her best, and is very glad that the procedure was successful. I had the best care in the first few days. I was in ICU for a day, and high dependency unit the second day. All the staff at Royal Brompton Hospital were absolutely amazing. They know what they're doing and what's necessary for heart patients. I had no complications. I had a bit of low blood pressure, but the staff were treating me with the best care possible. I got discharged. I saw also a physiotherapist that explained to me how to best recover after the surgery. And all the staff were very reassuring and giving me the best possible care. I got discharged in a week after the surgery. I got prescribed all the medication that I needed, and and got given a lot of advice how to continue my recovery at home. And then in a couple of weeks, I had my follow-up call with Dr. Yadav. She reviewed my medication and how I was feeling. And then I'm going to have one more echocardiogram to review the outcome of the procedure. I've had one in hospital that revealed that after the surgery I had trivial regurgitation, and it was very successful, and I could continue with my life as normal without any issues. Yeah, I'm very, very grateful to Dr. Yadav and the whole team about all the care that they provided. And I just want to reassure everyone going through similar things that you're in the best possible hands. Trust what they say, and I just wish you all the best, and lots of good luck with, yeah, with everything.